Hello, in this video I'm going to teach you some soft tissue techniques for the medial part of the shin. And what I mean about that is if I just bend my patient's leg here, then this area tends to be very painful on a lot of people. Okay, there's many conditions that we can call it. The common name is shin splints. However, we have to be a little bit careful with that word because the true name is medial tibial stress syndrome. And where the tissues come along here onto that medial border of the tibia and fibula, there are many muscles, I'll go through them in a second, and then they have a tendency to attach fascially to the periosteum, and then if they traction and pull, then you get this tiny little inflammatory process forming, and then it then causes like a shin splint. And what that means is where it attaches to the periosteum thinks it's been damaged, so it sends bone forming cells called osteoblasts to the area, and you get this little reaction, small areas, and that's why it's called like a shin splint. So it's a generalized term, but is medically known as either a medial tibial stress syndrome or a periostitis, or even a teno, where the tendon attaches to the periosteum, called a tenoperiostitis. To treat it, you almost have to control the position of the foot, because a lot of people, foot biomechanics is causing maybe this sort of shin type of pain. So you have to address that as well as treating in here. Now the muscles that come down, we can call them the Tom, Dick and Harry. So this is the right foot here. And then we've got the medial malleolus, the navicular, okay, and we've got the talus and the calcaneus here. So the Tom, Dick and Harry, so the T is the tibialis posterior, which comes down to the navicular tuberosity and it branches under the foot. And then, so that's the Tom. The D is the flexor digitorum longus. So digitorum, so it comes down and then it goes to the digits. And then the H is Harry, which means the flexor hallucis longus, which is hallux, which means the great toe. So it comes underneath. So they are flexors, which means they are plantar flexors, and they are flex the digits and the great toe, and also they assist in inversion as well. So if a foot pronates, for instance, then these tendinous tissues are going to naturally traction, causing this microscopic trauma to the periosteum in here. So you've got Tom, Dick and Harry. It's actually known as Tom, Dick and very nervous Harry, because you've got the posterior artery, which is called the posterior tibial artery, which is the A. The V is the returning vein, and then the N is the nerve, which is the tibial nerve, which comes from the sciatic nerve, and then it becomes the medial and lateral plantar nerve under the foot. So they follow that sequence, okay? So it's Tom, Dick, and very nervous Harry. So they'll follow that sequence, and they come round. They're part of the tarsal tunnels named after the Great Escape. You have the Second World War, where they tried to escape through the three tunnels known as the Tom, Dick and Harry. To treat, I use a bit of fascial wax by Songbird, and I've already put some wax on this area in here. So the pain is actually on the tibia along the medial border, but you'll find it can be exquisitely tender along here. So again, just be careful. And then also the soft tissues sometimes feel quite fibrous and firm. So I suggest you can do a little bit of treatment, even maybe a bit of ice treatment first, like an ice cup. You ice it, you do the treatment, and then ice to finish. The patient is going to move when we do this. So I'm going to get my patient to lift the foot up, even though it looks like it's down, okay? So that would be dorsiflexion and then plantar flexion. So by dorsi, we are lengthening the tissues along this medial border. So we start in a plantar flex position. Take a breath in, please. And I suggest you use your fingers, like me, and then I grip in. When you're ready, off you go. And I'm going to glide slowly through that medial border. So he goes as far as he can. Ease off. Take a breath. They breathe, I breathe. Breathe out. And I glide down again. Ease off. Breathe in, and I glide down. It's almost like a separation technique where I'm coming down through that. If you find it easier, you can, if you want to, just roll with one hand. Off you go, breathe. And as you breathe out, I can then glide down. The good thing is if you use one hand, you can use the other hand where I can passively lengthen. So I'm almost controlling, look at my hands, I control how much movement occurs from the foot and ankle complex here. So I'm controlling it. If I ask my patient to slowly push the foot towards the ceiling, push up, so he is plantar flexing, activating those muscles we've mentioned, the Tom, Dick and Harry. 10 seconds later, so this would be a muscle energy technique known as a post-isometric relaxation. He's contracted, 10 seconds, we have a window of opportunity to relax. Take a breath in, please. And as he breathes out, we can then glide through, knowing the tissue is now in a relaxed state. If we ask the patient to push down, okay, which means he's pushing up in theory, okay, which means he's dorsiflexing, it means this tissue is now inhibited. So this would be called a RI, which is known as a reciprocal inhibition. Again, he contracts for 10 seconds, relax, breathe in. And as he breathes out, I go through the same process. But now the tissues are relatively inhibited as I've gone through that. I don't treat this area for too long, mainly because it's very tender on palpation along this area. And if I work it, and I'm too firm with my tissue techniques, then I will exacerbate it. Okay, so bear that in mind the next time you're treating someone where they've got this obvious shin type of pain in here. So there's some technique for the Tom, Dick and Harry muscles. I hope you've enjoyed the video.